Why it's really relevant is a lot of the sarcomas happen in the pelvis, and we know from the Cancer Patient Experience Survey that lots of patients have had really poor conversations with healthcare professionals about sex life, reproduction. They're all the things that we're almost afraid to say, but that if you ask patients what really matters to them, it is something that's really important. And I don't treat prostate cancer anymore, but talking to men with prostate cancer, including older ones, it was very clear that healthcare professionals had made assumptions in terms of, oh, well, if you're over 70, then being able to have an active sex life is not important to you. And that's not true. And it's really important to some people. And some of the hormone treatments we put them on to deal with their prostate cancer make them feel very non-masculine, and that can be really psychologically debilitating for some people. And in terms of sarcoma, although we don't use hormone therapy as much, we do some pretty dramatic surgery in some cases, and that can have really major impact on how people feel about themselves, both in terms of psychologically, but their body habitus and confidence, and then also about their own personal sexual function. So if you damage some of the sacral nerves, and you can therefore no longer enjoy a sex life in the same way. If nobody's explained that to you, it's a really unpleasant surprise after the surgery. And I don't think these days adopting the attitude that, oh, well, I've taken the cancer out and it's gone, is good enough. And this is about how you live with and live beyond cancer, and how you're dealt with really well. And that's the radical treatment end. And then at the palliative treatment end, because there are so many different treatment options in terms of perhaps palliative radiotherapy, different forms of chemotherapy, different success rates and side effect profiles, you need to be able to help a patient understand what the potential benefits are for them and the impact on their life. And for some people, none of those treatments might be the right thing because of everything else that's going on around them. If you don't make an effort to understand those things for the patient in front of you, and if they're not in a position where they feel confident to describe them, I would say particularly for palliative conversations, but also consent for really radical treatments, you haven't got down to communicating with the patient at a level that's right for them.